The following segment is sponsored by Articus Biotherapeutics. A six-time PGA Tour winner, professional golfer Max Homa is teeing off to share his personal journey with seborrheic dermatitis and encouraging others to speak with their healthcare provider about their skin health. Joining Max today is board-certified dermatologist Tina. Welcome to the show.
Thank you for having us.
Absolutely. Okay, so Max, tell us about your personal journey with SebDerm and your 20-plus years struggling to manage it.
Yeah, so I was in high school and I noticed some flaking on my scalp, so I thought it was just your basic dandruff. And then I got a bit older in college. I started getting some redness around my nose, and it was quite itchy around my beard area. So then I decided to ignore that for a while and just hope it went away, which it did not. And then finally, my wife urged me to go see a specialist, so I went to a dermatologist, and pretty immediately she diagnosed me with seborrheic dermatitis, which I had no clue what that was. I was also very happy that you could shorten it to SebDerm. Once that happened, it all kind of clicked. Once she explained to me how it worked and how it appears, I was like, oh man, this is what I've been dealing with for so long. And I got prescribed Zeree foam, and I put that on once a day in the morning and then go about my day.
And how have you worked with your healthcare provider to diagnose SebDerm and find a treatment option that works for you?
Yeah, when I went in there, she asked me some questions about what I had been kind of dealing with or what it felt like, and then she obviously looked at the areas that it most commonly showed up, and she immediately kind of said, this is SebDerm, and then explained it to me. Once she kind of told me about the Zeree foam and how kind of light lifting it was, it's like, again, it's a topical, it's once daily, it's not greasy, it's kind of all the things that you would want it to be. I was quite excited because I think I would put it off for so long because I was worried it was going to be something very cumbersome. I was intimidated to go to the dermatologist. Like I said, I just thought I could kind of wish it away, which I didn't. So it's been great partnering with Arcutis to kind of get the word out that, if I could pass on one thing, it would be, if you got an issue or something going on, let's go talk to somebody who might have an answer.
Absolutely. And doctor, what are the signs and symptoms of SebDerm?
Yeah, so similar to Max's story, which I hear a lot of in my clinic, SebDerm presents as these red, scaly, flaky, sometimes greasy-looking plaques on the scalp. It can be in more visible areas like the face and even on areas like the chest and the trunk. These plaques can be really itchy and uncomfortable, and so it really is a tough disease to live with. And it's actually not that uncommon. There's 10 million Americans right now living with this disease, so that's why Max and I are excited to be partnering with Arcutis on this Free to Be Me campaign so that we can help raise awareness about this common skin condition.
Absolutely. And Max, what do you want people to learn from your story?
Yeah, I this campaign, the Free to Be Me, is three small, short words that I think mean a lot. I think a lot of people these days are dealing with being self-conscious. Myself, I play golf in front of a lot of people. I have to do interviews like this quite often, and the last thing you want to do is be thinking about your face. You just want to go put a smile on and go about your day. So I think, if anything, if you've got an issue, if you got something going on that you don't have an answer to, go ask somebody like a Dr. Tina Butani, somebody in your area that is a specialist, that's an expert, that can give you an answer, and hopefully you can then start your journey on overcoming whatever it's been happening. But for whatever reason, I was too intimidated to do it. So I wish I would have done it sooner, I guess, is the crux of this whole story.
Amazing. Well, thank you so much for your time.
Thank you.
Thank you.